Thank you. Despite the objection, I hope to have an opportunity later in the day to include this important amendment in this bill. This amendment is co-sponsored by Senator Bennett, Senator Hatch, and Senator Cole. Mr. President, I first note that my amendment doesn't cost anything. It doesn't add any money to this bill, and in fact, it saves money in the long term. My amendment represents a bipartisan effort to strengthen an important part of the bill, the health and information technology part of the bill. As we know, technology has transformed our country, and I'm encouraged that this legislation we are working on would develop a national health information technology system and create over 200,000 new jobs doing it. If implemented thoughtfully, health information technology has the potential to reduce waste, to rein in costs, to stimulate innovation, and improve quality. As you know, Mr. President, Minnesota is a leader in the healthcare community across this country with the Mayo Clinic and countless other hospitals and clinics in our state. We have been recognized for the measured quality outcomes that have resulted from effective information technology implementation. So we know what we're doing in Minnesota. In this bill, there is, as I mentioned, very good provisions for the development of health information technology. There are also some privacy provisions which are necessary and I support. We recently had a hearing on these provisions in the Judiciary Committee, and out of that hearing came this amendment. Because one of the things we recognized was that one of the privacy provisions, which while well-meaning, would have the effect of making it hard to collect data to improve the quality of care, something that Mayo Clinic does so well. One example, you'd save $50 billion in 4 years across this country in taxpayer Medicare spending if every hospital in this country used the protocol Mayo Clinic uses for the last 4 years of chronically ill patients' life. High quality, save money. But to do that, the reason they can do that is they collect data, so they know what that protocol should be. My amendment ensures that the quality assessment research necessary to improving our healthcare system is preserved. As the bill currently stands, all forms of healthcare operations are subject to regulations to be put forth by the Secretary of Health and Human Services. These regulations have the potential to impose varying levels of restriction on the ability of doctors and nurses to share information. While I support requiring authorization and the use of de-identifiable data in many areas of the healthcare system, subjecting quality assessment activities to these regulations has the potential to limit patient care and clinic research. That is the last thing we want to do right now as we are looking at collecting that information to spread these protocols across the country so we can get better assessments of what high-quality care means. That is why Senator Hatch and Senator Bennett are co-sponsoring this amendment with me. I will also note that this is supported by the American Hospital Association as well as the Association of Medical Colleges. With the U.S. spending $2.3 trillion per year on health care, we must bring an end to the inefficiencies of the system. We need the information, well-intentioned in this bill, but we must make sure that the work that's going on to share information continues. Thank you very much, Mr. President, and I yield the floor.
Senator from Minnesota.
Mr. President, I rise today in strong opposition to Senator Grassley's amendment, which removes the targeted assistance for the temporary increase in federal Medicaid funding. It is well established that Medicaid enrollment increases in direct relation to unemployment growth. For every percentage increase in unemployment, states see an additional 1 million people seeking Medicaid assistance. I find it deeply troubling that at a point when health care is most needed, Minnesota and other states will not be given the assistance that the situation demands. By eliminating the portion of assistance that is targeted based on states' unemployment rates, Senator Grassley's amendment would significantly reduce assistance for states facing the largest increases in their unemployment rates and the largest budget deficits. Instead of providing aid to those who need it most, Senator Grassley's amendment provides relief for states that are in some cases even enjoying a budget surplus. 19 of the 20 states facing the smallest increase in unemployment would get more assistance under this amendment. Is that an effective use of federal money? At a time when we should be focusing all our efforts on ways we can best spend taxpayer dollars, sending aids to states that have less need just doesn't make sense. I ask my colleagues to consider this. This is about accountability to the people of this country. This is about targeted assistance. We've heard a lot about targeted spending, putting the spending where we need it. This is also about targeted assistance to the states that need it most. Thank you very much, Mr. President, and I yield the floor.
Senator Montana.
Mr. President, I yield 5 minutes to the senator from New Jersey.